So we'll go ahead and get started. I want to first introduce myself, April Rowe-Neal. I am a department head, associate professor in the nursing department at Luther College. For those of you outside of our Luther and nursing community currently, we're really excited to have all of you joining us today. So thanks for tuning in. And thanks to Martha Oldenburg, a 2009 Luther graduate and a nurse in Seattle, Washington, working at University of Washington Medical Center in the medical intensive care unit, which receives many different patient types, including patients with cancer and lung problems. And so Martha has been so gracious to share some of her experiences as the assistant nurse manager on this unit. As we all know, the state of Washington is a hotspot for COVID. So Martha, I'll put myself on mute in a moment and turn it over to you. I am just going to make a quick note. This is being recorded. So if anybody has concerns about a recording, please speak now or forever hold your peace. All right. Thank you. Martha, I'll turn it over to you.
Hi, everybody. This is so fun. Thanks for being flexible and willing to try Zoom. I know it's not probably everybody's most familiar format, but it's a great meeting space, a great way for people to be able to pipe up and ask questions if you want to. April kind of sent me a few things that she thought might be interesting things to hear about. So happy to share my experiences and happy to hear what questions and wonderings people have. Like April said, I work in a medical and oncology ICU. My unit is about a third oncology ICU. Lots of people with leukemia and lymphoma, bone marrow transplants in that population. And then the medical ICU is pretty much everything under the sun. Anybody who comes into the emergency room and needs care in an ICU comes to us. So it's a very diverse environment for sure. My unit initially was identified as the place that coronavirus patients would come. We shortly thereafter converted another one of our ICUs into the coronavirus ICU. So currently, PUIs or patients under investigation, or patients under investigation, I think, of people who we suspect maybe have coronavirus will come to my unit to get ruled in or ruled out, and then either are taken out of precautions or then transition to the COVID ICU from there. So that's a little background about where I work. April had asked, I think one of the questions was, what was it like, or what were my thoughts when the first patient came in that we thought had coronavirus? So because my unit was identified as the place that these patients would go, the first patient who came to the U came to my unit to be tested. And because it was the first case, there was a huge amount of support. I mean, instantly out of the woodwork, our infection control team, our infectious disease doctors, our ICU team, everybody was there to kind of help coordinate. And in my mind, I was like, okay, we just need to make sure we do this right so we can keep our nurses safe, so that we know that we're doing the best thing that we can to keep our healthcare workers safe. There's definitely a lot of fear initially about, are we doing all of the precautions appropriately? Do we, there's still a question about how the spread is actually happening. And so there has been a lot of fear about wanting to make sure we do everything correctly, but we feel secure when we're following step by step to know that we're doing everything we can. So yeah, I mean, because it was unfamiliar, there was a lot of feelings of unease initially, but quickly, as like anything else, as you get used to it, as it lives in your environment, you get used to it a little bit. Yeah. Any?
Yeah. Thanks for sharing that, Martha. I think we can all envision the fear that all of the staff in your hospital were feeling. Can you talk a little bit more about your role as a leader on your unit and how you had to manage your own feelings as well as those of your team?
Yeah. So I'm an assistant manager, as April said. I'm on a leadership team of 3 people, another assistant manager, and then our nurse manager. I work, like part of my FTE is clinical, so I still do bedside work, and then I do management work as well. And initially my role was kind of being a part of the drills, as in terms of like role playing, in terms of how we're going to get the patients from A to B, and how are we going to don and doff all the PPE and those things. So a really big part of my role has been communicating what I'm learning from those meetings and those like simulation scenarios to the staff of, this is how the work is being done, these are the things we're learning. Tons of just, I feel like I'm an information highway most of the time, hearing it from one side and then trying to disseminate it to the staff. And, doing a lot, I feel like initially when there was that, like all of those uneasy feelings, a lot of my work was just talking through how the decisions were being made and how, like, who was working on it and who were part of deciding what kind of PPE we were going to use, how we were deciding that we were safe enough. And I think, like anything else, it's also just, if you know how those decisions are being made, you can kind of wrap your mind around whether or not you feel good about them. And so a big part of my job has been just like talking through that with people. And that helps staff feel more calm. It helps me feel more calm. It helps everybody feel a little bit more assured about the steps that we're taking to keep everybody safe. But yeah, a lot of also talking with my like lateral leadership members to see, how are things going on your unit? Are they doing things differently over there than we are doing over here? Trying to make sure that, there's equity in all of those areas and share what information we have. I hope that all makes sense. I feel like I'm reading a little bit.
Thank you, Martha. What has surprised you the most about the response in your area? So not that you necessarily have to speak to your particular unit or even your hospital, but even just in general in your geographic location.
I think it took a little while to, as it was ramping up, to understand how big of a thing this was going to become. But I feel like Seattle and Washington took it really seriously from our very first case, because we were the first case in the nation. We very quickly started putting things into motion to, like, social distancing immediately became a thing. Restaurants and bars closing was really closely following that. And there's been a drastic drop in how much people are just out and about, which I think has made a big difference. Something that surprised me, I guess, a little bit was how much of an outpouring to the healthcare industry there's been. I mean, there's just like, I feel like we're being treated like war heroes, which feels a little bit like, okay, I'm not actually in a war, but I kind of am, I guess. That part has been amazing to be in the receiving end for sure. But yeah, I mean, I'm like proud to live where I do, I guess. I feel like we took it really seriously from the beginning, and it feels like it's working. Our hospitals haven't been overrun, which is an incredible thing to be able to say, especially when looking at what's happening in places like New York. So yeah, I feel really lucky, honestly.
That's great. Yeah, that reading through the news and seeing some of the heartbreak that's coming out of the experiences in New York, it's great to hear that your area has been proactive and you feel safe.
Yeah, for sure. It is really heartbreaking. I mean, the amount of work that those people are doing in New York is astounding. And they're doing the best they can. It just is, it's like wildfire.
Yeah, we're having to adapt a lot of our normal procedures.
Yeah,
Which, yeah.
for sure.
One of the things what our students were particularly interested in is how have you had to adapt personal touch or kind of that sense of advocacy and connectedness that's so inherent in our nursing practice for your COVID patients and their families.
That's a great question. Actually, one of the biggest pieces of my job for the last 6 weeks has been, besides communicating with the staff about changes, has been communicating with our patients and their families. Immediately, we put a very strict visitor restriction set of regulations in place. And from the first day of that, I basically had to go room to room and tell people that they couldn't stay with their loved ones in the ICU, which is a really difficult thing. But with kind of talking through just the danger of spreading of this virus, people have been incredibly reasonable, but there's just been a lot of sitting with and spending time with people as they kind of wrap their mind around the fact that they can't be there all the time unless their loved one fits a very strict set of criteria exceptions. But our providers, our physicians, our nurses have done so much advocacy for, like, if they feel like there's a situation where the family member absolutely needs to be able to be there, we've had incredible advocacy. And it really is just like thoughtful conversations. And I mean, it never gets easier to say, I know that your husband is in critical condition, but I'm sorry, we just can't let you in the room to see him. Our hospital has actually just in the last couple of days invested in a lot more iPads and things to help foster actually doing Zoom calls like this with patients. So even if the patient is sedated and intubated, we can hold up a screen to show their family what's happening in the room and allow for video discussions. But yeah, I mean, we've done a lot of work to determine what is the safe thing to do to bring people in to see their loved ones, and when do we have to unfortunately say that's something we can't do. It's really hard, especially for people coming in with coronavirus who potentially are living with their family who have also been exposed. But there have certainly been situations where we've met somebody's family members at the door with a mask and PPE, and we don them at the door, escort them through the hospital, visit their loved one, and then escort them back out and doff their PPE, which is tough, but
Wow.
it's the right thing to do, for sure.
That sounds really tough, Martha. Can you talk a little bit about what helps you through those conversations? Because I can't imagine, having been a critical care nurse in the past, having to say to a family member, you cannot be here right now. It's not
Yeah.
safe. It's not safe for you to be here right now.
I think the main thing, so there was one day when I had to go around and tell 22 patients and their family members this news that this was going to be happening. The thing that really helped me walking into the room was knowing that it was absolutely the right thing to do. We have, my hospital's population is a huge percentage of oncology patients and a huge percentage of organ transplant patients. And we've had issues with an infectious disease coming and just running rampant through our community. And like really knowing that conversation was going to assist in controlling the spread among our patients and our healthcare providers was really helped me kind of hold fast to going in and saying these like really challenging words. And to be honest, there were a few patients patients and families who thanked us for having to put this really challenging restriction in place. They were like, their response was, we know that this is incredibly difficult and we know that that's not your normal culture, and we appreciate that you're taking it seriously enough to do something this challenging. So that really actually helped then balance out the patients where I had to walk in the room, and there are people who yell when they get stressed. So of course there are a few of those out there, but it really helped knowing that it was like, this is a vital way for us to be able to control the spread.
Yeah, perspective is helpful, absolutely. And just for the non-nurses in the audience, just to give a little bit of context, patients who have blood cancers like leukemia, lymphoma, or have had organ transplants that Martha referenced, those patients are often immunocompromised. So their immune systems don't work sometimes at all, because of either the diagnosis or because of the medications used to treat their condition. So definitely an added layer of complexity within that critical care environment for your patients, Martha. Is there anything else that has helped you cope with kind of the aftermath of some of those more difficult conversations? What kind of strategies have you used to maintain your own mental health?
Yeah, it's amazing how taxing it is to have a difficult conversation. I've had to have a lot of grace with myself with that. Like, you come home from a day of being on your feet for 12 hours and you're going to be exhausted. But coming home from a day of difficult conversations doesn't necessarily make you think, oh, wow, I really need to take a break now. So I've had to have a lot of grace with myself with that. I have a friend who actually does like nursing retreats, and she's been hosting virtual nursing retreats with mostly people that I work with. And so it's been a great forum to like do some like physical unloading. I think that has really helped, doing things like some meditative practices, some breath work, some like restorative yoga practices. It's really helpful to work in an environment where there are so many other management teams going through the same thing. And so we have forums to kind of discuss the really hard things that we're dealing with and share those experiences, but then also the like personal coping those practices of like the little retreat things have been really helpful.
So it sounds like really, really leaning into your personal and professional networks.
Yeah.
Has been a huge help.
For me and for our nurses, our hospital has really ramped up the support. We have a program called peer-to-peer support. We have free counseling. We have a lot of things that have been like heavily advertised to our staff to utilize So that's really also been nice to know that they're like, they want us to reach out and talk about it. They don't want us to just go home and, you know, try and shove it all down.
Good. That's great to hear. Can you share a little bit about how your past experiences have prepared you for this situation, both your liberal arts background as well as your nursing specific education that you received at Luther?
Yeah. There's like a little mantra that I don't remember which professor said it when, but I know that it came from somewhere in my education, that in a discussion of what a BSN is compared to a Bachelor of Arts, somebody, I can't remember who it was, maybe it was Jamie, maybe it was Jana, somebody just said, well, nursing is an art. And that like those three words have stuck with me seriously for 10 years. And it's so heavily in my brain that our patients are humans first, that I feel like that's made an incredible difference in walking into a room, and like every person who's laying in a bed has the same fears and the same anxieties as we do. And every family member has the same feelings as we do about our families. And I feel like that has made a really big difference, because medicine can be really science centric sometimes, but we're treating humans, and that I feel like that was really deeply ingrained in me at Luther, with the type of education that we had working with our patient populations. You have the heavy science of the Mayo Clinic, and then you have the Decorah nursing homes, which are just two incredibly different environments, but really show you that regardless of who you're taking care of, you have to treat human needs first. And that's been a big piece of my nursing career too. I've worked in a pretty wide variety of settings, and individualizing care is something that's important in every setting, regardless of acuity, regardless of patient situation. And I feel like that's really allowed me to walk in every day with like with fresh eyes and fresh motivation. But yeah, thank you to whoever said that to me. I don't know who it was.
That's an amazing message. And that's great to hear you say that, and that it's stuck with you across all these years in your professional practice.
For sure.
Yeah. What about teamwork? How has the multidisciplinary team adapted in this situation? You shared a little bit about kind of the community and professional support, but how are you working together to meet those human needs within the unit?
There's definitely been a really big shift in a lot of people's roles right now. In my hospital, I work really closely with our provider teams. It's a teaching hospital, and we work in an environment where everybody is learning and everybody is asking questions. And so that's already kind of ingrained in our environment, but this has really brought it to a new level of, we need to bring every member of the team to the table to have a conversation about, okay, what does this look like from your perspective? What does this look like from your perspective? What changes need to be made? Like yesterday, our acting medical director for critical care came and sat down in my office, and he was like, okay, I'm having a meeting with these other medical directors, and I need to understand what issues you guys are what issues you guys are experiencing compared to the issues we're experiencing, so then we can create a task force to basically work on those things. There's just been incredible openness to every member of the team to bring forward concerns and questions so that we can provide safer care to our patients and safer environments for our staff. it's been incredible actually to be a part of that, to feel like, oh, I actually do have a voice. When I like see a thing that seems confusing to me, they want me to ask that question. Our CNO and our chief medical officer and our chief nursing officer have literally been walking through the units every day and stopping people and saying, what have you encountered today that's confusing or needs clarification or needs to be changed? It's really brought this like new level of everybody is on the same level of just problem solving through this.
Well, and one of the things that I've noticed about University of Washington is that there definitely has been this desire to push information, policy, and practice changes out to the larger community of healthcare providers, right? It hasn't just been about developing practices and policies for your local team at the hospital, but the nationwide team that is coming together to approach this pandemic, which I think is really impressive and says a lot about your institution.
Yeah, I'm really proud of that. I think we felt from the beginning that we had a sense of responsibility because we're the first place that really encountered the first cases. We were in direct communication with the CDC about the current guidelines because our previous guidelines for like PPE had all been based on Ebola, which is a completely different beast than coronavirus. So yeah, I mean, I feel within our institution, there's that same push of like, we want everybody to be on the same page about what's going on. We have town halls once a week that are open to the public that you can Zoom into and listen to the most recent updates and questions that staff have. So yeah, I feel extremely fortunate to be in a place that wants to be that transparent about information.
That's great. It sounds like that's been a huge help in coping with the constancy of change. I think we're in healthcare, we're conditioned to expect very frequent changes, but nothing like what we're currently experiencing, where I've heard some people talk about hour by hour or minute by minute practice changes.
Yeah, absolutely. And our staff have been incredibly gracious to say like, okay, this change concerns me. Why are we making that change? And then wanting to reason and talk through it so that they can feel safe. Because if one day somebody comes in and says, you need to do this, and the next day that changes, how do you feel safe one day and then adapt your like threshold for safety with every new change? It's a very dynamic environment for sure.
Absolutely.
Yeah.
Well, you yourself are sort of on a non-COVID unit, but one of the questions posed are, how are nursing colleagues who are on non-COVID units handling all of the unknowns and the changes, some of which you just referenced, some of the changes to policy and practice?
Yeah. We are in a place now where we're testing every person that comes into the hospital. So it really is, it has its fingers in every area of medicine right now. A patient on any unit can test positive. So it really is, sometimes it feels like there can be that sense of like, well, that doesn't happen on my unit, so that's not really my problem. But with this, it's everybody's problem. And so there really has been staff from every area coming together and wanting to ask questions and learn. We also have staff from the non-COVID units that are volunteering to float to the COVID units. And that's also, I think, pretty impressive to also demonstrate that like camaraderie with the staff who have to be there all the time. There's been this feeling of like, it's not just their responsibility, it's all of ours to try and make this go as smoothly as it can. it also is like, it's kind of exciting to be in a place where we're watching science happen. We're like watching clinical trials, and we're watching virology labs somehow come up with figuring out how to test these people. So there's this sense of like, we do a lot of research in our institution, and there's this sense of like, oh, I actually want to know what's happening, what's the latest, what's going on with these people.
So a little bit more engagement with the evidence-based practice.
Yeah, for sure.
Yeah, great. Well, are there any other thoughts or reflections that you would like to share with our group? I think we can turn this over to questions if anybody would like to unmute and ask a question of Martha. We're happy to take some questions.
Yeah. I was going to say too, I know there's probably some people looking at graduation coming up. I obviously can't speak for institutions everywhere, but we have people who are on orientation right now who are dealing with trying to learn how to be ICU nurses in the midst of this, and just know that there's going to be a lot of grace for you as you enter the workforce. We know that this is not normal. We know that you can't be in clinicals right now. And wherever you get hired, I would like just encourage you to talk through like what accommodations might be made, since I haven't touched a patient now in 5 months. But there is like, those on the hiring end definitely know that there's probably going to be changes made to the orientation practice just to make sure that you are well-rounded.
Can you speak a little bit about your orientation practices, Martha? I know you, that's one of your responsibilities as assistant nurse manager. Can you share a little bit about what adaptations you've made?
Yeah. So like I said, we have people on orientation right now. We've had to do some restructuring to partially limit utilization of PPE. So we're actually taking people away from orienting on the COVID ICU and placing them in other areas. But we're doing a lot of check-ins with people right now, of just like, how are things going? How are you feeling? If we need to add additional time, if we need to add additional shifts or weeks, that's fine. Like, we're really encouraging people with any sort of symptoms to not come to work. And so rearranging people's schedules as we need to is happening. You know, it's kind of difficult because we can't meet in person as often as we usually do, but really trying to be intentional about reaching out by phone or by email or text on a regular basis to figure out how people are doing. And I mean, sort of like patient care, like it's a individualizing people's orientation has been really important through this. So just know that that's going to happen wherever you land after all this.
That's great advice. Great advice for our upcoming graduates to hear. So Martha, thank you so much for taking the time to chat with us and share your experiences and offer your advice. It's been really a great way for us to keep some sense of community as we are physically distancing ourselves this spring. And so we really have a lot of gratitude for your willingness to share your experience, your expertise, and your time with us. It's a huge gift. We're very grateful for that.
Absolutely.